From Jakarta, I'm Jeff Hutton, and this is On the Level. Today, Indonesia's capacity to test and track the coronavirus, which causes COVID-19, may have turned a corner. The country took delivery of new machines that can more than triple its testing capacity. But even with the added testing, might the coronavirus's impact be less awful than feared? Social distancing and a general willingness to wear masks may be helping. But might Indonesia's warm climate also be a factor?
Humidity and high temperatures, maybe it's possible that the speculation is true that the coronavirus 2019 does not survive as well in those conditions as it does in a cold, dry place. So Bali, for example, really by all accounts has a very modest case rate of COVID right now.
And then, what's it like to be a doctor in Jakarta during COVID-19? We take a ride with a pulmonary specialist on his way to work. He says that during a regular shift, he sees at least 40 patients. We discuss the discrimination medical workers and their families here are facing from frightened neighbors, and how his colleagues are under immense stress as they lose patients daily to COVID-19.
My colleagues, we have stress because our patients were dying. We have already given everything, but still the patients were dying. That made us more confused and desperate. Because the result is not what we expected. So many dying.
That's coming up. Stay with us. Indonesia's rate of infections appears to be accelerating. On its current trajectory, infections will end the week well over 8,000. But even that figure is tiny relative to other big countries like the US, where infections are closing in on 1 million. Kevin O'Rourke of Reformasi Weekly joined me for our regular roundup of Indonesian news, and we started with a discussion of what accounts for Indonesia's relatively low tally of infections so far.
And allowing for a much higher number of true infections, the curve in Indonesia is not steep yet. It's doubling at a rate of actually about 9 or 10 days right now, which is not a rapid increase, judging by the official numbers. But it is climbing, I think. The number that's interesting to look at is the new cases reported per day. And that bounces around quite a lot. For the past 6 days, it's been roughly in the vicinity of a little over 300.
But isn't that even a little bit suspect? It either speaks to a lack of capacity or something a little bit more sinister. In something like this, we should be looking at a much faster rate of growth, maybe even exponential. It's a bit suspect that we see a steady 300 cases almost every day. Isn't this meant to sort of double and rise at a faster rate every 3 or 4 days?
Right, but the doubling time for the official numbers anyway is actually only 8 or 9 days. So I take your point regarding the new cases per day. The question is that a measure of the capacity of Indonesia's polymerase chain reaction or PCR testing, or is it a measure of the actual new cases per day? To an extent, it is conditioned by the testing capacity for sure. This will change, I think, in the week ahead because Indonesia took receipt of about 18 or 20 high-capacity, rapid PCR test machines from Switzerland. I think they arrived on April 10th. And they'll be deployed and put in place around the country in the days ahead. I think some of them are probably already operating, and so that should increase Indonesia's testing capacity to about 10,000 good PCR tests per day. To put that in perspective, since the start of the epidemic until today, this is April 15th, Indonesia has done about 28 or 30,000 PCR tests in total. So it's going to dramatically expand the PCR testing capacity, and then we'll finally know whether these.
Did you say 30,000 in total, not per day?
Correct. Yeah. Since the epidemic started, there's been the last number I saw was actually about 26,000 PCR tests total cumulative to date, but that data was about 3 or 4 days old. So I'm assuming it's closer to about 30,000 by now. And now the capacity is going to be 10,000 per day, so it'll be a big change.
That is a massive change. What can we expect the government to be able to do armed with this basically real-time data almost? I mean, South Korea level type of testing.
Right. Yeah. Well, one thing is that there's going to be a need for yet more machines. Just given the size of the population, even with a relatively modest curve, even that 10,000 per day capacity will be inadequate at some stage in a few weeks, perhaps. But basically, though, with more accurate testing, it's going to be much easier to distinguish between groups in society who already has immunity, who has not been affected by the virus, who has it, and either is showing symptoms or not yet showing symptoms, and therefore it'd be possible to segregate groups, and the country will be able to operate more efficiently, basically, with this rapid, accurate testing capability in place.
So we need to brace ourselves for the ugly truth. And when that ugly truth, an image of that emerges, what will it look like in terms of numbers? I've seen some modeling that even in the most severe cases, virtual lockdown could expect 500,000 infections by the end of the month. What do you think?
Well, I'm starting to be skeptical about the worst case scenario proposition, because when you set aside the official case numbers, which are pointing to a quite a modest curve at the moment, then all you really have to go by are the haphazard reports of rapid serological tests for immunity, which are not very accurate, but at least it's something of an indicator. And then beyond that, you just have anecdotal reports about conditions in hospitals, the production of coffins for burials and that type of thing. So far, actually, all those types of indicators are not pointing to a massive spiraling of cases ramping upwards at a pace that's out of control at the moment. Indonesia's curve right now is not nearly as steep, I don't think, as the curves had been in places like Iran and Italy. Now, it may still happen. It may be just a timing lag for some reason, but I think it's just now starting to be possible to be very cautiously optimistic that Indonesia might be able to avoid a really catastrophically steep death curve.
Kevin, I have to gently push back a little here. But what about all this data that we're seeing about COVID-linked deaths in Jakarta that were easily double the announced deaths?
Yeah, but yeah, they were still in the hundreds, not in the thousands. And Jakarta is a province of 11 million people, and the greater Jakarta area is 34 million people. Yeah, it's basically the transmission rate seems fairly modest at the moment compared to the transmission rates that had been witnessed in China back in January, and then places like Iran, Italy, Spain, and recently in New York City. So transmissions are certainly occurring, the numbers of people falling ill are substantial, and the cumulative case total is growing, but the transmission rate is not super fast, and therefore the ramping up of the curve is not really steep. Now, it's hard to be sure about that, again, because the data is sketchy, but if that is true, it's interesting to speculate about the reasons.
Well, you think, yeah. Can you speculate about the reasons? That was my very next question.
Well, I think one is face masks, and Indonesians are accustomed to wearing face masks. They were already a very common sight years ago, simply because of the air pollution in Jakarta. And then, as is the case in most places in East Asia, people customarily wear a face mask as a courtesy to the community to protect others from their potential germs when they're feeling a bit ill. And there was an awareness put out by the task force, the COVID task force of the central government at a relatively early stage, in the third week of March, that really made clear to everybody in the country that face masks are very important. And so that's one factor. But the big one, another one, is the social distancing, which has been put in place in the hot spots, at least in the Jakarta region. But I think the big one, which is interesting to speculate about, may be the factor of humidity and temperature, because that is something that distinguishes Indonesia from those other places like northern China, Iran, Italy, and Spain, Europe, during the winter months. And with direct sunlight, humidity, and high temperatures, maybe it's possible that the speculation is true that the coronavirus 2019 does not survive as well in those conditions as it does in a cold, dry place. So Bali, for example, really by all accounts has a very modest case rate of COVID right now, even though it had massive exposure to travelers from China. There's only been 2 deaths, and both of those are foreigners who already had the disease when they arrived in Bali, I think. So I think there's a little bit of grounds for cautious optimism.
What do you feel your caution here? Mm-hmm. What do you need to see to be more confident?
Yeah, with these 18 or 20 PCR test machines from Switzerland put in place and operating with ample rapid, accurate PCR test capacity in place, then if the numbers remain fairly modest and the official case count continues to double at only a rate of 8 or 9 days at a time, then that would be quite convincing that the transmission rate in Indonesia is modest. Which could mean that it's a prolonged epidemic. Yeah, so the curve is flat, but perhaps prolonged, as opposed to extremely steep, but relatively short. It should mean a lower fatality total in the scenario, if this is true. But it would also mean that a need for care and proper restrictions on social mobility need to be in place for a longer period of time.
And support too. There's a lot of people out of work. The government cannot possibly have that kind of firepower to be able to be doling out the largesse that rich countries can. This has got to be hurting average Indonesians, right?
Yeah, because a huge swath of the population is vulnerable to downturns. So the official poverty rate is about 10% of the population, which is a huge number of people, about 27 million people living beneath the official poverty line, which is not even $1 a day per person. So those people at least already tend mostly to be in the system and registered for various types of support, which should be ample to protect them from real ravages. But there's a much larger category of people who number perhaps 50 million people who are quote unquote near poor, and typically they do not qualify for the various types of social welfare support programs that currently exist that President Widodo has been expanding over the past 5 years. And those are the ones possibly who are actually very vulnerable to downturns. A lot of them work as laborers in the informal sector, and so there's just not the types of safeguards and controls and support mechanisms in place.
Well, a little bit of optimism, but it's nice that it was mixed in there with your sobering account. Thanks so much, Kevin.
Yeah, sure thing, Jeff.
It seems a lifetime ago, but back in 2018, Jakarta hosted the Asian Games. It's a mass assembly of people that now seems unthinkable. In a sign of the times, last month, the athletes' village that was built for the Asian Games was converted for use as a COVID-19 emergency hospital. That's where I met my next guest, Erlang Samoedro. He's a pulmonary specialist based out of Persahabatan Hospital in East Jakarta. On any given day, he can see patients there, as well as at 2 COVID emergency centers like the one at the Athletes Village. Dr. Erlang was kind enough to speak with me recently. He was on his morning drive into work from his hotel where he's been quarantined from his family for 3 weeks. Just to set the scene, Dr. Erlang is young, glasses, mid-30s, round face, and he has a mild demeanor. On this occasion, he's flicked on his camera so we can video chat. He's dropped the phone onto his lap. I can see his surgical mask is down around his neck. For someone under enormous strain, separated from his family, who I learn are facing their own hardships, Dr. Erlang is in good spirits, at least for our chat. And during our talk, I watch as he regularly scans 180 degrees to avoid traffic, pedestrians, errant food carts. There's less traffic now, but this is Jakarta and you never know. I'll be honest with you, the audio isn't great. We were of two minds whether to share this interview with you. And sometimes Dr. Erlang can't quite make out my questions and answers what he thinks he's heard. Which, don't get me wrong, it was great, but it can be confusing for you. But asking Dr. Erlang for a redo, or worse, scrapping the whole thing seemed unconscionable. We decided we would do our best to make it make sense and have his story heard. Dr. Erlang, his wife, his kids, they're doing their best. Everyone's doing their best. We would too. Anyway, here's the interview. Dr. Erlang, thanks so much for talking with me. I see you're driving your car. Where are you headed right now?
Persahabatan Hospital from the quarantine apartment.
They give you a quarantine apartment, do they?
Yes. From the morning, and then I go to Persahabatan Hospital to see the patient.
How long will you be at the hospital?
Until 4 o'clock. Then I go to another hospital until 9 o'clock.
The other hospital, what's that? Is that the COVID-19 emergency hospital?
It's a Pelni hospital. It's COVID hospital too.
It's a COVID hospital.
Yes.
So you have a 9-hour shift ahead of you. How long have you been in the quarantine? How long have you been in the quarantine apartment?
For about 3 weeks.
When was the last time you saw your family? 3 weeks ago?
Yeah, 3 weeks ago I started working there.
You are a pulmonary specialist. Can you explain to listeners what a pulmonary specialist is?
we check the health of the quarantine people in the apartment. There's any chief complaint, and then I go to the hospital. Hospital is a COVID hospital in Persahabatan. From it's usual in the afternoon, and then I visit the COVID patients in the quarantine isolation chamber, and then at the evening until night, I go to another hospital. It's called COVID hospital too, in Pelni, from 7 in the night until 9.
How many patients would you see in a day?
In Persahabatan Hospital, around 20 until 30 patients, and then in the Pelni Hospital, around 30 patients.
So about 60 patients per day?
Around 40 to 50 patients per day.
I see.
COVID patients.
COVID patients. There are other patients too, yes?
Yes, there's another patient, but not much, not many as COVID patients, because this time is the pandemic, so there is a lot of patients with the COVID symptoms.
How many more patients do you see now during the pandemic than you did compared with before the pandemic? What was a normal day like for you then?
The usual patients is decreasing because they were all self-quarantine. So my patients decrease. Now it's only 10, the usual patients. Before is around 30. Now it's 10 to 20. So it's decreasing around 30%. But there is an increase in COVID patients up until 50. So it's the increase of COVID patient more than 100%.
Sorry, did you say your patient caseload has increased by 100%?
For the COVID patients. But for the usual patients, the ordinary lung disease, tumors like that, is decreasing.
It's decreasing, yeah. There's been quite a lot of news stories about doctors and nurses getting sick from with COVID-19 and some dying. There's about 24 so far, 22 or 23 or so. Why are so many doctors and nurses dying, do you think?
Okay, because at the first we didn't enough protections, not the you see the attention is not that high, but now the awareness is very high, so everybody uses the protective equipment. Around 2 weeks ago, there is no one using the protective equipment, so they were getting the COVID around 2 weeks ago, but now it's decreasing. But still, there is still several nurses and doctors were getting COVID.
Do you have enough equipment now? The PPE, the face masks, the visors, the gloves, the gowns. Do you have sufficient quantities of those?
The problem is on the mask. N95 mask is now less. So we use the mask in the Pelni Hospital for 5 days, one mask.
I'm sorry, did you say you use one mask for 5 days?
Yes.
Even now?
Yeah, even now.
That's extraordinary.
Once we use this, and then we disinfect it with the UV, and then there's a machine for disinfect it, and then use it again, for the next day until 5 days, and then we change to the new one.
Is that according to WHO guidelines, or is that just because you have no other choice?
There's literature about the prolongations of the uses of the mask. So we use that. There is an article about that. Prolong the uses of the mask.
You seem like you're in good spirits. You seem to be smiling, and from what I can see from my vantage, yes. you seem to be all right. But you know, Indonesians can be very polite. How are you coping? What's your mental health like, and the mental health and the mood and energy of your colleagues?
Oh, yes. My colleagues, we have stress because our patients were dying. We have already given everything, but still the patients were dying. That made us more confused and desperate. Because the result is not what we expected. So many dying.
On a typical shift, how many people will you lose?
Right now, there is a four patients where we are losing. The patients, and it's already died. So today, and we are facing what the stigmatization of the medical officer that will die, and then they refuse the body from the community. It's hurt us.
You're having difficulties returning the bodies.
Yeah, especially the body of the medical officer who died.
The medical officers who died.
Yes.
I don't understand. Why is that particularly problematic?
Yeah, because we're giving all we have to the patient, but when we were sick or die, there is a stigmatization from the community, from people. That hurt us.
Are you facing a lot of discrimination from neighbors, from the community?
Yes. Even my wife, that they know that her husband is working at the Persahabatan Hospital. They don't want to speak, and then wearing mask immediately after they see my wife. Just like that.
Is your wife facing discrimination from the neighbors just because she's married to you, even though you're not even there? You're in a quarantine apartment.
Yeah, I work here at the hospital, right?
Yes. And so your wife is also facing discrimination and harassment?
Not the harassment, but the gesture is not the harassment, but the gesture of the people. It's like that they were worried about that.
That's understood. Do you have children?
Yes, but they are all now not going to school because school is closed.
And so your wife is there with the children. How many kids?
3 kids. 3 kids. 2 girls and 1 boy.
Well, I'm not going to take up any more of your time. Thank you very much for talking with me, Doctor.
Okay. Bye.
Bye now.
Bye.
Bye. and that's On the Level. Our producer is Stephen Handoko, research and reporting by Imam Shofwan. We used music from Ketsa on the freemusicarchive.org. And I'm Jeff Hutton. See you next time.